of the dance hall. Africa, Jamaica. The girl say me better than bad when me come in and me don't defend the ghetto youth when me sit on me.
Hey everyone, I am back with a new video. I'm unsure what the title of this video is going to be. I'm sure if you clicked on it then you already have seen it. So I'm going to get started. This is basically one update for multiple weeks because I have been running a little behind ever since I found out. It's a lot of things that's been going on and I'm just trying to catch up. So, I'm gonna try not to make this video too long, but I'm gonna try to hit as many points as I can as well. So let's start off this from 4 to 8 weeks. So around 4 to 5 weeks is when I actually found out, around the 5-week mark. And as you can see, if you haven't seen the first video on my live pregnancy test video, I will link it below and somewhere on the screen here, so you can just click on it and watch that and then come back and watch this video. But yeah, I found out then, I would say around 5 weeks or so, between 4 and 5 weeks or whatever. So I made my first doctor's appointment after I found out, and then I went there. So this is a brand new doctor for me. I had a normal OB/GYN that I would normally go to, but I decided that the hospital that they were affiliated with, I didn't want to go to the hospital. One, because it was quite a distance from where I live, and I'm known for giving birth quickly. That was one, and it's just so, the hospital is just so out of the way from family, and it's just far. So I was like, okay. And not only that, but with that office is really busy and they have so many patients, it's hard to get an appointment, and when you do, it's like weeks from when you made it, and I don't like that in doctor's offices. So I was like, okay, I'm gonna have to find a new OB. So I found a new one. It wasn't as close as my older one, but it wasn't that far. It was maybe like 15 minutes away. So I went there, and before I even made the appointment, I read the reviews. He had great reviews, and the office was great, and everybody seemed to love him. So I was like, okay, I'll try him out. So I went to the office. I already knew the area, but I didn't know the office was there. So when I went in, the office was nice. I have to give him that. The office is actually nice. And I met with him. They took urine, they took blood. And then I had to sit down and talk with him. Now, he didn't know like cultures or anything. He didn't touch me at all, didn't check me for anything, whatever. So I told him what was going on, that I had a positive pregnancy test or whatever. And then, so now he's talking to me, and he's just like, one strike for me was, he was talking to me like I was already a risk. And I'm like, why are you making it seem like, you know what I'm saying? And he even told me that he wanted to put me in the high risk category. And I'm like, but why? Like, this is our first visit. You haven't gotten any blood work back. You haven't gotten any lab tests, like nothing. And all of a sudden I'm high risk. What? So he was like, one reason that he said he thought I would be high risk, so he wanted to put me in the high risk category, was because I had preeclampsia with my first child. Mind you, that was almost 9 years ago. And I've had a child since then, and I didn't have preeclampsia with that child. So once again, you haven't taken any tests, you haven't seen any lab work on anything, and all of a sudden, that's one of your reasons. I was like, okay. And then the second reason was because of my weight, because I am overweight. And I'm like, okay. So now I'm thinking to myself, I'm like, okay, well, is he like not used to delivering or taking care of overweight mother? Is that the case? Maybe, or that's kind of what I was thinking at first. But then I remember in the waiting room, and even I had to go back in the waiting room to get blood work after I talked to him, and this woman in there my size and bigger. So I'm just thinking, like, why is he putting me in this category where I'm high risk? He even wanted me to see a high risk doctor, y'all. Like, he wanted me to go see a high risk doctor specialist and him at the same time. And I'm still like, but why though? Like, you know what I'm saying? Like, why? And then he was like, he wanted me to take the 24-hour urine test, which I knew that was gonna happen. But he was like, he wanted me to take that early. and he wanted me to do the glucose early. Like usually you do glucose in your second trimester, like well into your second trimester. I think in, you know, you're around your 20s weeks. He wanted me to do it in like 2 weeks. I'm like, what do you do? Like, I have no history of that, of high glucose levels or diabetes while pregnant or anything. Like, I don't know. It was just so weird. And I was like, well, okay, but why? And those were the reasons he was giving me. Like, all the reasons he was giving me was like precautions to things that would put me in high risk. But he was already putting me there, if that makes sense. So I don't know. So after that, I was like, okay, well, let's get the blood work and stuff back or whatever. We'll see. So that was the first visit. To come back, which was the next day, I believe. Yeah, it was the next day for sonogram. Excuse me. So I went back the next day for sonogram. So mind you, the first day they didn't even verify that I was pregnant. There was nothing written down in stone or anything saying, yes, you're pregnant. You had a positive pregnancy test. We did this, we did that. Even though they took urine, nothing. Okay. So the next day, they told me that all the blood work and stuff was supposed to be back. So I came back the next day to do the sonogram. Mind you, the blood work wasn't back. And I was like, okay. I was really frustrated with that because that would have determined, that would have had my verification of me being pregnant. I needed something written saying, yes, you're pregnant. You know what I'm saying? For multiple reasons. So I went, she did the sonogram. She did it on top of my stomach. And then she was like, she didn't see anything, but it was okay because it was still really early, you know, blah, blah, blah. At that point, I was, I think 5 weeks at that point. Yeah, I was 5 weeks. And I was like, okay, so she did the internal sonogram. And she was like, you know, we can see things better when it's internal. So she did it and she still didn't see anything. And she was like, don't be alarmed. It's okay. You're still really early. Sometimes we don't see anything this early. She didn't understand why he wanted me to have a sonogram that early, and I didn't either. But I was so excited to be able to see something. I just was like, whatever, because I guess that was one of his precautions or whatever. So she was like, the only thing that she told me basically was that I had like bruising on my right ovary, and that happens in pregnancy because that basically shows where the ovary that you ovulated from to conceive. I was like, okay. And that still wasn't enough to verify anything, y'all. So I left there and I'm like highly disappointed at this point, but I'm like, all right, whatever. I'll just wait for them to call me. Mind you, they never called me for my blood work. They never called me for anything. I had to call them. So I called them the next day and they were like, oh, we don't have it. I was like, okay, but y'all was supposed to have it yesterday and y'all didn't have it. So what's going on? They was like, it's been, you know, really backed up at the lab and blah, blah, blah. Call tomorrow. I said, okay. They didn't call me the next day. So I called them. And they were like, oh, we still don't have it. Matter of fact, I'm going to call the lab and get your work. I was like, look, I don't care about the rest of the stuff on there. Y'all can handle that when y'all get it. I just want to know my levels. Just tell, you know, my HCG levels. So she calls me back and she's like, oh, yeah, your levels are at 41. Okay. I was like, okay, so that's in pregnancy range. Anything over, they say anything over 5, but I think the range is like 5 to 25, then they consider you pregnant. I was like, okay, so that's in the pregnant range. Like, is that bad? You're saying it, you're pausing, like, what is it? And she was like, yeah, but it's still kind of low. We can't say that you're pregnant or not. You have to come back and do the blood work again. I'm like, okay, lady, like, y'all playing with me now. Like, you know what I'm saying? Y'all playing with me. I said, okay, I understand that because every 2 to 3 days your levels double. So mind you, the first day I went was a Tuesday, and your levels, your ACG levels double every 2 to 3 days. So at this point it was Thursday. So it should have doubled by then or the next day, which was Friday. So I'm thinking she's gonna be like, okay, we'll come in tomorrow. You know, we do the test and you'll get the results, you know, Monday or whatever. Yo, why she tell me to come in 2 weeks? I was like, no, absolutely not. I said, okay, well, I'm gonna have to give you all a call back because it's ridiculous. It had been at that point a week and it was still not verified that I was even pregnant. Like, I've been here almost 3 times and still nothing. Like, are you kidding me? No. So I was like, okay, well, I'm gonna go to my regular OB, the one I normally go to around the corner from me, next week or whatever. So I made the appointment, and they made the appointment for, it was either Monday or Tuesday. It was actually Monday. It was Monday. So I was like, okay, cool, whatever. So that night I started cramping like really bad. And I was like, okay, what is this? I was like, it could be implantation type cramping. I'm not spotting, I'm not bleeding, I'm not clotting, so that's good. Let's just wait it out, right? Mind you, this is one of the symptoms I had been having because before I even took the test, because I thought I was going to come on my cycle. So anyway, I kept cramping, and it kept getting worse and worse and worse, right, throughout the evening and night. So I was like, okay. It got to the point where I literally had to take, like, if I didn't take anything, I would be like almost in tears. It was that bad. And I have really painful menstrual cramps, so it was bad. And I basically was sitting here like, am I miscarrying? Like, you know, what's really happening? And I didn't know anything because no one had verified anything, you know. So I took a couple more pregnancy tests that I had at home. They still came up positive, so I was like, okay. But what scared me was one of them came up actually lighter than the day before when I took one. And I was like, oh my gosh, like, am I really sitting here about to have a miscarriage or having a miscarriage and don't know anything? So I was like, okay, well, I'm just going to go to the hospital. I waited till my husband was asleep because he has to get up and work at like 3 in the morning. So I was like, I'm not even going to trouble him with it, because if it's nothing, it's nothing. I put my daughters to bed or whatever, and then I went to the ER. So I went to the ER, and I'm explaining to them what was going on or whatever, and they were like, okay, well, we're going to run some tests. We're going to, they did a sonogram, they did blood work, they did urine, and they did cultures. So long story short, with the ER visit, after everything, they had determined that not only had my numbers doubled, but they damn near tripled. It went from that Monday when I did the blood work at the doctor's office, it was 41. By then, this was Friday, and my numbers were 359 or something like that. So they were like, okay, so you're pregnant. You're still pregnant. You're not having a miscarriage. You're not bleeding. You know, when we did the cultures, we didn't see any sign of blood. We didn't see any spotting. We didn't see any clots or anything. So you're good. I did have some protein in my urine. So they were like, I may be coming on to like an infection or something. So they gave me some antibiotics. With the sonogram, she was unable to see the baby because the baby was too small, but she did see the sac that the baby was in, and then they knew, and that was a good thing to know because the sac was in the uterus. It wasn't like in the fallopian tube or wherever, because wherever the sac is where the baby's going to be growing. And I was talking to the sonogram lady, and I was telling her I had one, you know, whatever, and she was like, and she didn't say anything, and I was like, no. And she was like, yeah, either she didn't know what she was doing, or they had an old or bad sonogram machine. And I was like, why would you say that? She was like, because as soon as you it's right here. She was like, you have to, of course, you're extra early, and it's not like you have to really search for it, but if you know what you're doing, you would have seen it. I was like, oh, okay. Confirmed what I was saying, but okay. So anyway, I left there. They said the cramping was normal. I probably will have it for the next couple of weeks, but it should die down if the cramping gets any worse, or if I start bleeding or anything, to come back and blah blah blah. So I was good. Even though I was cramping, I was still cramping into the next few days, but it did get less and less and less. So at least, you know, everything was verified and I was okay, and I wasn't having a miscarriage. That put my mind at ease, you know. So yeah. So on to the second visit. So Monday comes around, and I have my second visit with my regular OB around the corner from me. And then I go in and basically do the same thing. They don't do the culture, but they did blood, they did urine, and I had a sonogram for the next day. I don't know why they kept doing sonograms. I don't know. But so anyway, the same day they verified I was pregnant. The urine came back positive, of course, and then the blood work came back, and everything, all of that was fine. The cultures from the hospital was fine. Everything that they did, everything came back normal. They wanted me to do a 24-hour urine test, which I hate. And they give you this jug, and you have to basically urine and put your urine in the jug for 24 hours and store the jug in like a cool place. And then after 24 hours, you bring it back to the doctor's office. And they did that because, of course, of the preeclampsia. Because if I have preeclampsia, it will basically show up in the urine, basically indicating that, hey, you know, you have preeclampsia or something's going on. We need to monitor it so you don't get preeclampsia or whatever. So she was like, she wanted me to do that. Dr. Dawes wanted me to do that just as a baseline. So everything came back normal. Nothing's going on. Nothing's happening. Nothing. No levels are high or too low or whatever. Except my vitamin D, but that's a whole different story. So yeah, I got the results from that. They verified everything. I had everything I needed. Boom. So the next day I come in for sonogram. So she do the sonogram, and she does it on top, and you clearly see it. It came up like boom. In the hospital, like I said, she had to look for it a little bit, but you can see it. But here, it was just like boom. So I was like, okay, so I'm growing, you know, little by little, but I'm growing, and you can, you know, see it as soon as it pops up. And then she did the internal one, and then when she did the internal one, it was like a speck. And she was like, do you see that? I was like, yeah. And she was like, that's the baby, but it's not, you know. She was just saying, it's just, you're so early, you know, to really see anything going on, you know. And then that's when she told me, and actually the lady in the hospital told me this too, doing the sonogram, that they think that I am a week behind. So if I go according to my last menstrual period to date, for example, my due date is August 2nd, and as of right now, I will be 8 weeks in 1 day. But they said that I'm measuring a week behind, so instead of being 8 weeks in 1 day, technically I'm 7 weeks in 1 day. But it still hasn't been technically verified either, because the doctor hasn't said anything. The doctor at the hospital didn't say anything about it, and my doctor, after getting the results, haven't said anything about it either. So they want me to do another sonogram. They wanted me to do one this week, but I don't think that's going to happen. So I'll probably do one next week, because Christmas is coming up, and you know, all of that. And then my next appointment is January the 12th, and at that point, according to my dates, I'll be 11 weeks. Yeah, 11 weeks pregnant, and they want me to do a sonogram then as well. So we will see about that. So that is my spill on the update. I'm definitely right now going to go over my symptoms because they're crazy. Okay, so I'm going to start at 5 weeks around the time I found out my symptoms. About the time I found out, I had no clue. I had no idea. So I didn't have any symptoms at all. But literally, as soon as the cramping started to go away, all of the other symptoms started to come up. Okay, and I don't like it. So the first symptoms that started coming up was I had a lot of anxiety, and I don't know if that was around all the doctor's visits and this and that, or what was going on, but I'm not one that have anxiety, but I had a lot of it, and it was kind of weird, and it was stressing me out. And of course the cramping. So once that started to subside, like I said, then the nausea came. Now when the nausea first came, it was here and there. It wasn't like nausea, boom. It was just like, oh, my stomach doesn't feel a little good, and then later on I'm fine, you know. And it was like that off and on. And then my boobs started to really hurt, but that was off and on too, so it wasn't too bad. I started to get a lot of hot flashes though. Like I will be hot, and then I'll just automatically start freezing. Like it was just back and forth like that all day, and it was annoying. And then I started to get like really tired. Like even when I wasn't asleep, I had to be like sitting or laying down. Like it seems really lazy, but what it felt like was I was like running, but I wasn't moving. Like my body felt like I had just ran a marathon or something, like, and I didn't do anything. So yeah, that was nice. So recently, let's say the last week or so, I'm gonna say in my 7th week, because technically according to my dates, I'm in my 8 weeks, 8 week and 1 day. So last week in my 7 weeks, this is what's been going on. So nausea has been kicking excuse my language, my ass. Do you hear me? Nausea has been kicking my ass. I'm talking about to the point where every minute of every day I am nauseous. I am nauseous in the morning, I'm nauseous in the afternoon, the evening, the night, overnight. If it was any other time in the day, I'd be nauseous in that too. Just nauseous. It's lovely. My boobs, oh my god, my breasts hurt so bad. They're so tender. My nipples are so tender. Oh my god, oh my god. Like my comfortable, I can't even wear my comfortable bras. You know us girls, we have our comfortable bras once we wear around the house. We just got out the shower, we're chilling, you know. Then we got our everyday bras, then we got our cute bras, you know, just like panties. Y'all know what I'm talking about. I can't even wear my comfortable bras, y'all, no more, because because I have big boobs. Y'all can't really tell, but I have big boobs. I am a size past the triple D at this point. And I believe that's a G. But my boobs, because they're so big and because they're so heavy, they don't sit up here on my chest. Okay, they come down here a little bit, and then sometimes they kind of like lean, like they push their weight down on my stomach sometimes, and that makes me nauseous. So it's just, y'all, being pregnant, you know. And then, like I said, then they hurt. So like the comfortable bras aren't that supportive. So because they're not that supportive, it just doesn't help. You know, it just doesn't help. But yeah, they hurt pretty bad. I'm also, with the nauseous feeling, I feel sick. You know, you ever had the flu or really bad cold, and how you just sit back and you're just like, oh, that's how I feel all day, every day. And it's probably because of me being nauseous all the time, because I'm sure, because the times that I'm not nauseous, I'm up and I'm me. But when I'm nauseous and I just don't, and I just feel like, ugh, it's just terrible. Going with the nauseousness again, I'm having a lot of smell cautions. Okay, any and everything that I smell, I hate. Any and everything I smell, I can smell things from a mile away, and nothing smells appetizing or good at all. And don't have it be something where it's like, oh my gosh, like a burnt smell or just anything. I don't like the way, like earlier today I gave my daughter a hug. I didn't like the way her hair smelled, and I'm saying it like I stink or her hair stinks or my house stinks, or you know, and it's definitely not the case, you know. It's just individual odors. It's just I don't like it. When I cook, like I can want something and then I'll cook it and I'll smell it and I won't want it. Or I'll have to like force myself to eat it. Or while I'm eating it, I will be nauseous and be gagging through the whole thing. If anyone else cooks, no. I'm talking about any and everything. Like the other day, I couldn't even wash dishes because whatever, I had made some fried potatoes and onions in a pot. And then I let it soak overnight because the bottom got a little scorched. So I come back the next day to wash the pot, and I could not wash the pot. Like I almost threw up like 3 times trying to wash this pot, y'all, just because of how it smelled. Like, what am I supposed to do with myself? Okay, like the smells are crazy, and I hope that dies down because it is terrible. And I was sitting on my couch the other day, and I have a candle. It's like a vanilla marshmallow candle, and it was like on the windowsill. And mind you, the windowsill from where I was sitting is just like clean across the room, blinds over it and everything. And I'm like, what is that smell? And my daughter's like, what are you talking about, mommy? And I was like, it smells like marshmallows or vanilla, or no, marshmallows. And she was like, mommy, I don't know, I don't smell it. And I was like, no, I keep getting a whiff of it. And she was like, oh, it's the candle. And I was like, what candle? And she was like, over there. And literally she had to like move the curtains out of the way. I smelled it clean across the room on the windowsill behind curtains. Crazy. I'm still tired. I still feel like my body is going through a lot right now. The way I can describe all my symptoms right now is so elevated, so heightened. It feels like my body's never gone through this. Like, I don't know, like it's a shock to my body. I don't know what it is. It's hard to explain, but I'm just really tired all the time. I don't want to do anything. I get an attitude when someone asks me to do something. Like my aunt asked me the other day, today, she was like, you're gonna bring the kids by tomorrow to pick up their Christmas gifts and take me to get your sister's gift. And I'm like, I really don't feel like it. Like, I really don't feel like, it's not that I don't want to help her out or, you know, have her see the kids or anything. I just don't feel like the extra, you know, I really don't. But I'm gonna do it to get out the house. We'll see. I'm not gonna make any promises. So what else am I? Emotional. I've been kind of emotional. Like I said, there's been a lot going on lately. I haven't been emotional to life quite yet, but I always do this when I'm pregnant. I cry at the craziest things, like commercials. Mostly movies. When I watch movies, if a part comes up and I relate to it in a heartfelt way or it's sad or whatever, I'm crying, boo-hooing. Okay? And I'm like, oh my God. And I hate it. I hate it. I'm just like, tears coming down. I hate this. Or I'll be on Facebook and I'll see a video and I'm like, nope, I'll keep scrolling. I'm not going to do it. And my daughter laughs at me all the time. She's like, what, mommy? What is it now? I was like, nope, not today. Not going to do it. Oh, another kind of strange feeling, symptom that I'm having is that I'm having a lot of like stretching and like pulling, tugging type pains. I know my uterus is growing. This week they said my uterus is double the size or something like that. But I can definitely feel it. Now, I'm not saying I have a 3 or 4 pound baby in me quite yet, but I can definitely feel it stretching and growing. And I can feel it from the inside out, which is also strange. Like right now, I feel as if my stomach is huge. And I believe to be honest with you, if I was like really skinny, I believe I would be showing. Because I know my body and I can feel it. Like I can literally feel it. And it's kind of funny being 8 weeks and feeling like just feeling it growing. I know it's growing. Like I can feel it. I can even feel it like around the area because it kind of, I feel like it's just such a strange feeling. It almost feel like I could feel things moving out of the way for it. Like, you know, it's just that round ligament pain and I can literally feel it stretching. I literally can feel my uterus stretching. And it's kind of weird yet happy type emotional type thing. Because I know that I'm not going to do anything but get bigger. But I feel as if now things are actually doing something. You know what I'm saying? Like things are starting to happen. So yeah, that's another thing that's happening. Yeah, I think that's about it, you guys. I know this is a long video and I'm so sorry. And I promise you I'm going to do week by week now. I'm actually probably going to do another 8-week video within the next couple of days. We will see. If not, then I will definitely see y'all next week for week 9. In between time, I'm going to do other videos on here too. Maybe a couple of vlogs and some challenges, which is going to be hilarious coming up. So stay tuned for that. And once again, I apologize that this video was so long, you guys. But it was technically 4 weeks in this one video. So I will see y'all later. Please subscribe if you haven't. Write any comments below. I'll answer everything. Yeah, thumbs up and just stay tuned for more. I'll see y'all later. Bye.
Yeah. King of the dancehall. Africa, Jamaica. The girl say me bad.